Good evening, everyone. Welcome to AVPN's inaugural South Asia Impact Capital Festival. I'm Allie Hollowell, Chief Product Officer at AVPN, and your MC for this evening. For those of you who do not know AVPN, we are a network of funders and resource providers with over 600 members across 32 markets. Our mission is to move more capital towards impact in Asia by providing social investors like yourselves opportunities to connect with key stakeholders across various sectors and markets, to learn from one another and to find opportunities for action. Throughout this month, the festival will spotlight best practices and solutions that AVPN members are delivering across India, Bangladesh, Nepal, and Sri Lanka. They will address issues ranging from healthcare, livelihoods, climate action, and education, which are all of particular urgency for the subregion today. We will be sharing highlights of the festival live on Twitter, so don't forget to share your experience with us by using the hashtag AVPNSouthAsia2021 and hashtag social impact. A few housekeeping announcements before moving to the program. To download any session resources, please click on the download icon in the agenda page beside the session title. To continue chatting with your speakers and fellow delegates in this session, please make full use of the messaging function or the event feed in the platform itself. Finally, please note that this session will be recorded and you will have access to the recordings for 3 weeks after the festival. As we've all seen, the current pandemic has hit vulnerable populations the hardest and exacerbated structural inequalities in society. Besides the obvious health implications for individuals, the global pandemic has exposed the weakness of healthcare systems at large and uncovered many other systemic challenges that need to be addressed urgently. It is for this reason that we're kicking off the festival with healthcare this week. For this session, the IDinsight team will be focusing on data for crisis response management. Led by Raghav Adlaka, IDinsight's Chief of Staff, this session will dive into IDinsight's data on-demand infrastructure and how this helped to build systems and processes, including an end-to-end patient management system for the Delhi government, and conducted rapid phone surveys across 9 states to help decision makers understand the social, economic, and gendered impacts of COVID-19. Raghav, thank you for joining us tonight. I'll hand it over to you now to introduce the other speakers.
Thank you so much for that introduction, Ali. And as you mentioned, we're going to be talking about our experiences of working with governments. And through that, we're hopefully going to make the case about why such engagements are a meaningful avenue for philanthropic investment. And we're also going to share our thoughts on how funders and practitioners can set up their engagements with the government to maximize their potential for success. I have a couple of colleagues with me on this session today. We have Dr. Divya Nair, who's a director at IDinsight and leads our health and nutrition strategy, as well as our COVID response team. She's led learning partnerships in India across a range of sectors in both health and nutrition, as well as a range of other sectors as well. I'm also joined by Dr. Karan Nagpal, who's an economist based in our New Delhi office. He has over 8 years of work and research experience on the provision of public goods, primary healthcare, sanitation, and data collection innovations. And at IDinsight, he's been the technical lead for our embedded engagement with the Delhi government, where we help support the city's COVID response. Before we get started with the session, just a brief introduction to IDinsight. We're a global development consultancy that aims to amplify social impact through the use of evidence-based decision-making. And we work closely with a range of stakeholders, be they governments, foundations, NGOs, and provide them with a host of analytical tools to help guide their decision-making. We're a team of about 160 across Asia and Africa, but our largest office is in Delhi, where we have about 60 people. And we primarily work with the government. So Divya and Karan, say I'm a funder looking to invest in opportunities to create social impact in India, and I'm trying to figure out what kind of entity to fund. There's just so much diversity, whether it be nonprofits, for-profit social enterprises, or government organizations, that I really have to understand which avenue provides me the most sustainable path to impact. From your experience, what's the best way to create sustainable change? Divya, perhaps you can kick us off.
Sure, it's a pleasure to be here. Hello, everybody. Yes, so I just want to kind of reiterate, IDinsight is a very mission-driven organization. Our focus is very much on social impact. And to do so, we measure ourselves and, kind of decide on whether to engage in a particular project based on depth of impact and breadth of impact. And also the sense of, how IDinsight is placed to kind of contribute to that impact. And so given that, there's a range of possibilities in terms of working with government, non-governmental organizations, directly with donors, and we do all of that. But in terms of, sustainability and social impact, our sense, and I think for this particular forum, what would be useful to highlight is really the interest and excitement working with government, given the breadth and depth of impact that you can, kind of catalyze while working with government. And to give you a few examples, basically, IDinsight has been working, for example, with Niti Aayog on the Aspirational Districts program. And what that means is that, we're kind of supporting a performance-based outcome management system where IDinsight is supporting now across 116 districts, but earlier on across 27 districts, we were collecting data on a range of indicators, including health and nutrition, to start with 27 districts. And that represents about 60 million households. So, just kind of in terms of the scale, it's exciting and giving a sense, like keeping a pulse on these households over time, giving the government a sense of what's happening, how change is unfolding, is useful for monitoring purposes, so that government can then iterate and respond to some of this change. The other advantage of working with government is the ability to crowd in others. So a range of departments are involved. They also work with non-governmental organizations. So in terms of like scale, there's the sense that you really are, engaging with a large ecosystem. So that's in terms of the breadth of impact. In terms of depth, I can just talk quickly about some work that we've been doing in the health and nutrition space. In particular, IDinsight has been working quite closely with a range of nutrition partners and with the Ministry of Women and Child Development on Poshan Abhiyan. And Poshan Abhiyan, basically, one of the key prongs of Poshan Abhiyan is social and behavior change communication. Now, what does that mean? Basically, there is the sense that what a child eats in their first 1,000 days and how they're nourished is important in terms of, that the developmental milestones that child reaches over time, physically, but also cognitively. And, it isn't necessarily intuitive in terms of what to feed a child. Many of us would use Google or expert books, etc. But for a poor family in rural Rajasthan, to get that information accurately, can be challenging. And so the government has invested across 21 different platforms to get that information across. And IDinsight basically kind of mapped out all these 21 platforms. And then we have been conducting surveys of around, large surveys of 5,000 households plus regularly to get a sense of what are the platforms that are actually reaching a randomly selected mother in Rajasthan or UP, Bihar. And then what are the messages that she's able to recall, and, is her knowledge correct? So one of the pieces of information that was important was that actually interpersonal communication is very important. And, the Ashas and Anganwadi workers who we regularly hear about are really like the main interaction for these poor households. So we found that 80% of these households were being reached by a frontline worker, as compared to, for example, a WhatsApp message or Facebook, which we also looked at, where, WhatsApp messages around 20%, actually 30% of households were receiving this kind of information via WhatsApp. This is pre-COVID. So, in terms of like how that information could be used by government, the government then has been very open to kind of understanding. And the thing is, as I said, government is not one person. So it includes the national government, state governments, also a range of other implementing partners who are working in this space. So they've used this information to then kind of fine tune their communication strategies. And for us, in terms of the motivation to kind of support the system, it also is to improve the systems building. So really supporting frontline workers, making sure that they are well equipped when they reach these households to provide the right information is an area that we're working actively on. So that hopefully gives you a flavor of the breadth and depth, and also different ways in which you could approach work in this space with data and evidence.
Thanks, Divya. So, say I'm convinced by your pitch about the need to work with the government, and I decide to partner with them on a project. What are some things that I should be cognizant of and be aware of before stepping into this context? Karan, maybe you can share some of your thoughts.
Yeah, sure. I agree with all the points that Divya made. But to your point, Raghav, I mean, working with governments, as many people know, is not an easy task. I can briefly talk about our experience working with the Delhi government on their COVID-19 response. And I'll use that example to illustrate some unique challenges that funders and organizations that work with governments should be prepared for. So in terms of our work with the Delhi government, we received a request early in May. This was when the cases were the first wave was just picking off in Delhi. Cases were rising very rapidly from a few hundred to reaching about a few thousand within a couple of weeks. At that time, Delhi government was maintaining the COVID data in multiple different Google Sheets and other data systems that didn't often speak to each other. And so, it was very hard for them to get answers to questions that they wanted immediately. And so, we were brought in to help build that data system that could cover all aspects of the government's pandemic response. And we partnered with Dimagi, which is a partner organization that focuses on building technological solutions for the social and government sector. We partnered with Dimagi. Within 2 weeks, we built a data system that was not exactly fit for purpose, but almost there. And all this happened while the first day was happening. So cases were rising, in fact, literally all around us in the government offices. People were coming down with COVID, and it felt very much like building an airplane while you were already flying it. And so, thanks to the Magi and government in engagement and our work, we were able to pull off that system. And once that system stabilized around July, August, we did use a lot of that data to advise the government's response to COVID in a way that was based in the numbers, based on the evidence. And then by October, November, we transitioned this data system off to NIC, which is within the government, so that can then sustain itself for the long run. There can be more ownership. The government manages the data. And so a few of the challenges that came up in that project that I can use to illustrate this overall challenges with governments. One is, of course, high stakeholder churn. The fact that lots of stakeholders, bureaucrats, politicians, frequently get transferred, and sort of in this case, some of them came down with COVID, and so we had to really reinvent the wheel in some ways every 2 weeks, sort of rebuild our relationship, rebuild trust and credibility every few weeks. Having sort of champions and constant engagement helped with that, but that sort of was a challenge that often, isn't faced. And second was, that people you were working with, the bureaucrats, the politicians, they were all very great, very smart, very engaged, and really wanted to do good work and committed to a very good response. The challenge is that they were really overburdened, so there's a lot of work, and so they were given way too many responsibilities, and so it's was challenging to actually get them to work with on the data system. And the third is that everything had to be done yesterday or even last week, because it was such a fast moving problem. And so we had to take all these decisions that, in a normal project, we would spend a few weeks deciding over and piloting and taking feedback. All that time wasn't there. And, some of them worked out. In some cases, we took decisions that constrained us further down the road. And so that was a challenge. And so having said that, I mean, we invested a lot in within those constraints in getting as much feedback as possible. And when there was resistance from the front line that was actually going to use the system, we paused. We said, look, we have to, improve the system before, we can use it sort of before we can move it practically and scale it. We said, let's take that feedback. And so, in some ways, one lesson was to not push through these changes and really make sure that the frontline workers who are leading the response to COVID feel supported, are supported, and that the data system works for them.
Thanks for that overview, Karan. But abstracting away from this specific project, what do you think are some of the major challenges of working with government vis-a-vis, say, working with an NGO or some other kind of partner?
Yeah, no, so I've spoken a bit about, these challenges just now, but apart from that, I think, broadly, 3 challenges come to mind. One is that, especially more than NGOs and the private sector and philanthropy organizations, decision making within government is a slow and uncertain process, slower and more uncertain than in other places. Stakeholders such as bureaucrats change fairly regularly. The command structure evolves, and even if sort of the top leadership says yes, let's do this, it takes a time before that decision can actually be implemented. I think government systems are fairly designed to mitigate risk and to prevent people from taking risks, and that means that the response is often slow. The second is the incentive structures are a lot more complicated within government, and it's important to spend time understanding them than they are in the private sector or with NGOs. I think often the role of the media and the judiciary, as well as promotion incentives, re-election incentives, these play a lot of a big role in these decisions. And so often these incentives conflict, and there are trade-offs that have to be made. And I think people should spend a lot of time trying to understand these incentives. The third is, when it comes to consulting organizations such as ourselves and others, governments don't often pay for these services themselves, or don't pay the full price. And so that results in some principal agent problems where, sometimes we've seen that governments don't take full ownership of the project because, this is something that's sort of coming to them. And so they will listen, but they will not take as much ownership of the in pushing forward that project. And the second is, even from a funder perspective, governments are care about many sectors at once, whereas funders care about generally specific sectors. And so there is this misalignment where funders want to fund governments to do their sort of favorite sector, be it education or health, but government's priorities change much more quickly. And so I think that those are some of the challenges that we have seen in our work with governments.
Thank you so much for that overview, Karan. So, assuming that I now have a reasonable grasp of all the benefits that Divya listed out earlier on, and all the challenges that you just illustrated, what in your experience are some of the ways that I can structure my engagements with the government in some way that I can, balance the constraints and the challenges that you've enunciated, and still be able to maximize my success to ensure that my investment is returning social impact in the way that I'd like?
Yeah, so I mean, we have iterated on this, over many years now. And I think the sort of what we are landing on is these embedded units, these partnerships that we call learning partnerships, because both us as an organization that's supporting the government and the government are learning together on the project. And that sort of is a more integrated partnership where, we are able to build trust and settle into a working rhythm with the government, be more responsive to the government's needs and priorities, and also sort of get in early, right? So often we are asked to come in and evaluate something once the project is already over, which is kind of an afterthought, and that doesn't help. As Divya was saying earlier, our main mission is to make sure that the data that we produce is actually used to take decisions, and it doesn't help if we come in later for the evaluation. We want that evaluation to be useful, and so LPs allow us to get in very early, and work closely with the government. So something that we're doing with the Delhi government now is building off our COVID work and our previous work in health and education. We have started a broad-based unit called the Data for Impact unit, which is going to work on the government sectoral priorities, but also do a lot more sort of culture, build a culture of sort of using data and evidence, provide people the tools to use data and evidence, at the government level, and do more cross-cutting work. I think we end up often underestimating the time and resources required in capacity building. So these type of partnerships also allow us to build capacity within the government so that they can take forward the work we have done. Funders and organizations like IDinsight will be helping the government only for a definitive period of time. It can't be permanent. And so I think one thing that we're learning is the importance of investing early in thinking about how does the system integrate with the government. So one example I gave earlier was our data system on COVID, which is now fully owned and managed by NIC within the government. We've recently been supporting the Delhi government to do an employment survey, and one of our major focuses on this has been to sort of not do the survey ourselves, but just to build government capacity overall to do better surveys on their own. And I think there's a lot of lip service in the sector to capacity building. I think two insights that one should take away from our experience with capacity building: one, that it has to be a continuous engaging event. It should not be a one-off event. It should be a continuous engaging process where you are able to build capacity at the right level and sort of improve performance. And secondly, I think it's very important to know that what the end goal is, right? So capacity building to do what? Capacity building for what? Rather than just capacity building as an end in itself.
Thanks, Karan. Thanks for that overview. And, I think, Divya, you've also led a number of learning partnership style engagements with the government. So maybe you can also tell us about some of your experiences of what kinds of structures work to maximize our impact with the government.
Sure, yeah. Echoing what Karan was saying, our sense is that learning partnerships really, and allow us to achieve our mission, which is very much oriented towards being responsive, being timely, being client driven, but with the goal of being, social impact driven. So, what a learning partnership really helps you to do is to identify key areas which are most meaningful. And then really kind of lean in on those areas and support, government. And as I said, that ecosystem to achieve particular goals. To do that, kind of zooming out a little bit, what has been useful for us is both being prepared like externally and internally. So externally, what I mean is, having these relationships. For example, the Karan's experience with the Delhi government is also based on these deep relationships that have been built over years. We started out, with a smaller engagement. And basically, in the context of COVID, for example, we were really able to provide responsive support. Similarly, for us, given the data infrastructure that I mentioned, where we've been collecting data for across the aspirational districts, we had that relationship already in terms of, with various, funders and governmental organizations. So, for example, when COVID broke out, there was the sense that we were well placed to get a sense of what the effect was of COVID. And so IDinsight over the last, basically 7 months has collected around 7 rounds of data from these districts and beyond, and we've been able to kind of provide a pulse on what's happening in terms of economic effects, social effects, also early on in terms of attitudes towards COVID and COVID prevention, etc. So basically, being plugged in, having trusting relationships, being able to then like package the information in a way that was useful to various parties in the ecosystem. I think all of that was, important for us to kind of enable this ecosystem, specifically government, to use this information. And similarly, again, building off of what Karan is saying, we are really leaning into building these evidence units. We are setting up similar ones at the state level. And the sense is that working with states on particular topics of interest to them is, and providing them the data and analytics that they require so that the policy is evidence-based and is really kind of a very like tried and tested and important pathway to impact. And for example, we really are hoping to work on some of the frontline worker effectiveness. That was an area that I'd flagged earlier, and we're excited to really like support in training, basically helping frontline workers to use data for themselves at that level, so that it's kind of a tool for them as compared to a reporting mechanism where they're sending information upwards. So that was the external piece. Internally, I just like to mention that the reason why we were able to respond to a lot of these demands quickly and potentially effectively is that we do have these systems in place. So we do have a data on demand infrastructure. Again, drawing from some of the work that we've done on a range of projects. IDinsight manages about 1,000 surveyors across the country, and this is a growing number as we speak, where we are really able to ensure high quality data is collected quickly and on time, and we can vouch for the outputs that are created. And we use a range of data quality checks, including machine learning, etc. So having that system in place really enabled us to respond quickly to, for example, the COVID surveys. And within 10 days of the lockdown, we were able to collect information and provide it to the highest levels in terms of what the effect was across important parts of the country. And similarly, having these teams at the back end who are able to really like pivot and be agile and nimble, and also like have a high quality, have a high bar for quality is important. So we have a strong technical team and, a lot of like checks and balances within the organization so that, that trust is built. And as we are agile and nimble. So I would say, being flexible, rigorous, all of that is important. But then to do that, you need to kind of set the foundation early on and investing in those systems. And from a funding perspective, it's great if funders could consider like investing in organizations to build, organizations' capacity to support, unlock potential in government, etc.
Great. Thank you so much for the conversation today. I think that's where we're going to leave it. Thanks, Karan and Divya, both for some engaging points and hopefully a lot of food for thought for our audience. Thank you so much for hosting us, and we hope that it was helpful. Please do reach out to us if you have any further questions over email or through our website. Thank you also to AVPN for hosting us, and we hope we have a great festival ahead. Thank you.
Thank you, Raghav, and the IDinsight team for that very interesting session. We've now come to the end of this emerging landscape on using data to drive crisis response management. This session is made possible with the kind support of our festival partners, Bill and Melinda Gates Foundation, Sesame Workshop India, the Rockefeller Foundation, COVID Action Collab, VNV Advisory Services, the British Asian Trust, WPP India, CSR Foundation, Catalyst Management Services, and SETVA. We will be continuing with the next session in about, I believe it's in 10 minutes. Finished this session slightly early, but this next session will be on emerging landscape on improving primary healthcare in India through tribal health collaboratives. And that you can find that link back on the agenda page, or it'll be here in your chat function soon. Thank you, everybody, and enjoy the rest of the festival. Thank you again to the IDinsight team for joining us tonight.
Thank you
very much.
Bye-bye.
Thank you.